Namaskar, I am Dr. Tarun Jindal, Head and Senior Consultant, Uro-Oncology and Robotic Surgery at Narayana Superspeciality Hospital, Andul Road, Howrah. As we all know, this month is being celebrated as the Testicular Cancer Awareness Month, so I have come in front of you to discuss about the testicular cancer. Testicular cancer is probably one of the most common cancers in the most important age group of 30 to 40 years. It is found in this reproductive age group, and the common presentations are asymptomatic swelling in the testes. So the patients do not have any pain. The patients just tend to notice that of late they have started to have a testicular increment in the size of the testis. Now, once the patient comes to us with these kind of issues, we usually send them for an ultrasonographic examination, and ultrasonography is one of the most important investigation in these patients. Ultrasonography gives us an idea whether we are dealing with a testicular tumor or whether we are dealing with other differential diagnoses like hydroceles or some hematomas in the testes, like that. Once the ultrasonologist says that no, there is a very high possibility of this lesion being a testicular cancer, we evaluate the patient further with certain blood tests which tell us whether what kind of testicular cancer we are dealing with. We can also have a CT scan of the abdomen and chest done at that particular juncture. And once the entire staging by the chest CT scan, ultrasonography and the blood test is done, then we proceed for surgery. The surgery, there are two options of surgery, whether we remove the entire testis or we remove the part of the testis which has tumor in it. The testicular cancers by and large carry a very good prognosis, that is, the outcomes of these patients is exceptionally well, provided we are able to manage them as per the recommendations made by the medical societies. So the two types of testicular cancers which we commonly deal with are seminomas and non-seminomatous germ cell tumors, and out of these, seminomas have the excellent prognosis. At times these patients require some surgeries in the form of removal of the nodes which are present in the abdomen. Nowadays these surgeries can also be done in a minimally invasive manner, and I am very happy to inform you that we have the largest experience in the eastern part of the country of the removal of these tumors by robotic approach. In a conventional surgery, once we are offering for removal of these tumors in these patients, so we have to give a very large incision which almost cut open the entire patient's abdomen, and then we get into the abdomen to remove these masses. But with the advent of robotic surgery, we give very small incisions, just like 5 or 6 holes of 8 mm in size each, and we are able to do the entire surgery through these holes. The advantages of robotic surgery over a conventional retroperitoneal lymph node dissection is that the patients can be discharged within 24 to 48 hours. In the conventional operations, these patients require a hospitalization of at least 7 to 10 days. The pain is extremely less if the patients are being managed robotically as compared to if you are cutting open the patient and then managing this particular patient. So my message for this month will be, please do not neglect any hump, bump or lump in your testis. Please examine your testis regularly. Testicular cancer is a very prognostically a very good cancer. It can be managed very well. Please don't be afraid that you have landed up with a testicular malignancy. Now the cure rates are more than 95 to 98% with the advent of newer technologies, newer modalities, radiotherapy, chemotherapy, and the advent of minimally invasive surgery. Thank you so much.